4, 5, sometimes some of them don't even have any identification. Some of them are unconscious, had no means of identification. And then you leave, that person in the hospital. And many times they don't even come back to find out what's the state. Especially, well, let me not mention. I wanted to say the Nigerian police, but let me not mention. I know I've mentioned already. You bring somebody in and then you drop the person, and then you don't even come back to find out, and there's no effort made to trace the contacts. That patient, is abandoned. How be it, not voluntary. So we see such cases. So when people come in on emergencies, we try to attend to them.
Okay.
But the challenge is usually after the initial emergency period for the continuation of care. Because if you come in and then you are not taken care of, after that initial treatment, you come in and you do not have the money for you to buy your drugs or do your necessary investigations, the challenge is that care may even fail or may not be optimal. That's another aspect. But I think what we're discussing here today is the fact that despite the best efforts of the hospital management in attending to patients in emergency situations, even when they don't have money, subsequently what we see are that some patients will remain in this hospital for months.
So how do you cope with these expenses? Do you get funding from international organizations? Do you get funding from local organizations? How do you get the monies to raise and keep these patients?
Absolutely not. We don't get money from anybody. It becomes, in a few cases, even the nurses in the ward may be forced to feed a woman. Maybe assuming it was a lady who was rushed in from some remote village, difficulty in labor, and a cesarean section has been done. In some cases, the baby may die. In some cases, the baby may survive. And then afterwards, there's no money for drugs. There's no money to feed. You see the nurses. Many times, what I see here, a passionate appeal from the ward charge, appealing for some money for me to release so they can buy drugs, right, for her to prevent, infection or, to save her life. And it gets so bad when even the nurses and other patients have to contribute money for the patient's feeding. So imagine the scenario in which a woman is lying in the bed in the ward with a baby, and she doesn't even have any money to feed herself. And on the issue of abandonment, yes, what we see sometimes is the husband may be the one bringing her down. But when he hears the amount of money, the bill, you don't see him sometimes for weeks.
There's a case in point where a father came to NTA bringing a baby as his son, and he told NTA that this baby was abandoned at birth by the mother because he couldn't pass urine and he couldn't pass excreta. So, I guess there are other cases like this.
We see cases.
So what's your advice to people? Should a mother leave a son?
You have to understand, why would a mother leave a child? That's the first thing you have to ask yourself. Either she has mental issues. I don't want to say she's mad. She has mental issues. She may be depressed, or she may have all manner of issues. Or the most common one is economic, when she just cannot cope anymore. And I'm sorry, I'm going to talk a little bit of politics. I'm a public servant. I'm non-partisan, but I keep on talking about the need for us to have this social safety net for the poor. We need to, as a government, as a society, be able to take care of our poor. We talk about universal health coverage. I'm sure you've heard of the term, whereby somebody should be able to access care without untold financial hardships. Why should you have to sell land or sell your house or sell just to access basic care? So it all boils down, to economic reasons. And I think that I've actually seen that the major cause of this abandonment is economic reasons. And if I can shock you and tell you that on an average month, what I sit down here as a chief executive to do to waive bills, sometimes up to 10 million naira every month, bills that you have to waive for indigent patients who cannot pay. These bills could have been used to pay, money, to pay diesel, to pay for drugs, to pay for all that. So what we need to have in our society is to have that universal, you have to have, health insurance or health coverage, whatever you want to call it. I think it's a responsibility of the government to pay for, provide help for the poor. Yes, there are some schemes and all that coming on, but these things have not yet reached our state. Some states in the country are already beginning to practice. We need to be able to provide, because without that, we'll still have lots of these cases of abandoned babies, abandoned patients.
Okay, let's look at the hospital holistically. What are your challenges beyond all of these abandoned babies? How do you cope as a federal government parastatal?
It's been tough. Yes, we are a federally funded institution. We never forget that, because the University of Uyo Teaching Hospital has almost about 2,000 staff of all manner, clinical, non-clinical, supporting and all that. Everybody helps make the hospital work. If the federal government did not pay our salaries, I'm not sure that we would generate, if all the money we generate, would not be able to pay more than 2 months of salary in a year. So we're grateful to the government for payment of salaries. The federal government also makes provisions, for us for, some of the capital projects and some overhead. But despite all of this, it's really not even nearly enough. We've had to manage. In the second segment, I think we'll talk about, isn't it, the challenges, and then maybe I'll use that opportunity to enumerate a lot of the other challenges that we have.
Can you do that in just a minute or two?
Challenges?
Yes.
First of all, power. If I can shock you to tell you that we don't have power here. We're connected to 2 lines, but I don't think we get more than 10, 12 hours of power in the whole week. So we have to generate more than 90% of the power we use. And the current cost of diesel. We use about 1,500 liters of diesel at 900 and something naira. That should tell you what we're using. That we're spending at least 35 million every month on just power. So the number 1 challenge is power. If we could have power, I'm very certain our services would improve. The other challenge is human resources. And we are not insulated from the brain drain and JAPA syndrome. We've lost quite a lot of our specialists, but yet we try. Now the third one is still the fact that if you understand how this institution grew, we have morphed over the last 30 years. Well, not really up to 30 years, but getting close to 30 years, about 26 years now. Over the last 26 years, from a state specialist hospital to a teaching hospital, without the commensurate infrastructural, Kwaibu people.
So you're calling for the state government?
Calling for the state government.
To help.
Something as basic as power. Help us. Really help us, because it's become very basically unbearable for us and even for our patients.
Okay, what's your last word to people, to Akwa Ibom people and Nigerians living in the city, in terms of your services to them?
Well, I would say that I have spent 4 years now in the saddle. I'm in my second term. And in the first 4 years, our emphasis was on infrastructural deficit. That's why you come in here, you've seen so many things. So we really did not have the infrastructure. Imagine the whole hospital was in this block. Remember? Once upon a time, it was horrible. Now we've been able to complete most of those things. Over the